just going to move from section to section. Why don't we take a question all the way in the back? I know sometimes people sitting in the back don't get an opportunity. The person with the Michigan hat on. He's right. Well, that's
yeah, one of the problems I got with what I'm hearing today is that we're not talking about our children and grandchildren. I'm a retiree with a 26-year-old daughter who works full-time so she can have health insurance and also goes to school pretty much full-time. Not quite, but pretty much. I think we need to have single-payer health care. I personally support HR 676. I think it's a fine bill. Profit out of health care and move towards a not-for-profit health care system. If the insurance companies today are spending 20% of the premium on management, on making profit, and Medicare is spending 2% of our premium on administration. It just seems to me that moving towards a non-profit healthcare system for everyone, including my daughter and her children, and her children's children, is the way to go.
Thank you for your comment. I know postal worker from the AFL over here had a comment similarly, and obviously there are a number of people in the room who support a single-payer system, and certainly Congressman Conyers has taken great leadership on that. And you're absolutely right. One of the things the President has said is if we were starting from scratch, that probably would be the way to go. And he's also said over the course of the campaign and being in the White House that sometimes he always wants to hear from people whether or not we all agree on the way to go, because we learn about a lot from one another and having that conversation. I mean, he believes, in looking at everything that we've learned over the last couple of years, that because this problem is urgent, looking at our ability to move legislation and get it done, that building on our current healthcare system is the way to go. I know not everyone in the room agrees with that, but I want to be forthright with you and say he did make the comment that you said. I think he stands by that, but he believes the course that we're taking right now is probably the most expeditious one to trying to get our costs down and trying to bring people into the system and making sure that we have affordable, quality healthcare for all